Welcome to the Explainer. You know, we're constantly interacting with a whole microscopic world, on our skin, in our gut, in the air we breathe. And for anyone heading into the dental profession, understanding this world isn't just some abstract biology class topic, it's literally the foundation of everything you're going to do. All right, let's dive right in.
First things first, let's just tackle a super common mix-up right off the bat with a simple question. Most people, they use the words infection and infectious disease like they mean the same thing. But in microbiology, they are worlds apart. And trust me, getting this one distinction right, well, it's the key that unlocks everything else we're going to talk about.
Okay, so here's the crucial difference, and it's a big one. Infection, which is just a microbe getting into your body and starting to multiply, is incredibly common. I mean, it is happening to every single one of us all the time. But infectious disease, that's actually rare. That's the consequence. That's when you feel sick, the fever, the pain. That's your body's reaction to the microbes, their toxins, and all the inflammation that follows.
So that brings us to our first big idea, our first section. We have to hammer this home. Infection is not the same thing as disease. This idea completely changes how we should think about our relationship with the microbial world.
And this concept has huge implications for your work. Just think about the mouth. It's the perfect example. It's packed with billions of microbes. So by definition, it's in a constant state of infection. But a healthy mouth is in a diseased mouth, right? The microbes are there, but everything is in balance.
So that's the million-dollar question, isn't it? What is it that tips that balance? What makes things go from this harmless state of infection to an actual harmful disease? Well, to figure that out, we have to rewind a little. We need to look at how a microbe even gets to a person in the first place.
And that brings us to our second section, the chain of transmission. Think of it like this. For an infection to actually spread and have the potential to cause disease, a whole series of events has to connect. Just right.
So this chain has three critical links: a reservoir, a mode of transmission, and a susceptible host. Now, every single thing you do for infection control, washing your hands, sterilizing instruments, it's all designed to do one simple thing: break one of these links. For now, we're going to focus on those first two.
Okay, so the reservoir, that's basically the microbe's home base. It's where it lives and multiplies. It could be soil, water, animals, you name it. But in a clinical setting like a dental office, the most important reservoir is other humans. And this is so important. This includes asymptomatic carriers. People who are carrying a pathogen, who can spread it, but they don't look sick at all. They feel totally fine. That's exactly why we have universal precautions, right? You treat everyone as if they could be a potential carrier.
All right, so the microbe has a home. Now it needs a ride. This is its mode of transmission. And for those of you going into dentistry, two of these are just absolutely critical. First, indirect contact. This is through what we call fomites, things like a contaminated instrument that wasn't sterilized properly. The other big one, inhalation. Think about all the aerosols that get kicked up from a high-speed drill or an ultrasonic scaler. I mean, those are your primary battlegrounds for keeping things safe. Okay, so let's say the microbe made it. It found a ride and it's arrived at its destination. But just because it's there doesn't mean it's going to cause trouble. Its ability to actually cause disease depends on the tools it has in its toolkit. This is what we call virulence, and it's what we'll cover in our third section, a microbe's arsenal.
Think of virulence factors as the specific weapons in a microbe's arsenal. They're the molecules, the structures, the strategies that let it invade, dodge our immune system, and, actually cause damage.
So what's in this arsenal? Well, you've got things like adhesins. They're basically molecular superglue. A classic example is Streptococcus mutans, the main cavity-causing bug. It uses these adhesins to latch onto your tooth enamel. That's step one for tooth decay. Then they've got slimy capsules to hide from your immune cells, enzymes that literally dissolve tissue to help them spread, and of course, powerful toxins. But maybe one of the most powerful weapons of all is their ability to team up and form biofilms.
So, if we zoom in on toxins for a sec, there are two main types, but I really want you to focus on endotoxin, also known as LPS. It's actually part of the bug's own cell wall, specifically for gram-negative bacteria, and it gets released when they die. Why does this matter so much in dentistry? Because the single molecule, LPS, is a huge driver of the chronic inflammation that just chews away at the gums and bone in periodontal disease.
And this quote, this really gets to the heart of why biofilms are such a huge problem. Dental plaque is the quintessential biofilm. It's not just a pile of bacteria, it's a fortified city. The bacteria inside are incredibly protected, way more resistant to antibiotics and even our own immune cells. And that right there is why you can't just use mouthwash to get rid of plaque or take a pill to cure advanced gum disease. You have to physically go in there and break that structure apart. That's what mechanical cleaning's all about.
So what happens when the microbe's arsenal is just too strong for our body's defenses? Well, that's when an infection can go from being a small, local problem to a big, systemic one. And that leads us to Section 4, when infection spreads. This escalation doesn't usually happen all at once. It happens in stages. It can start with bacteremia, just the presence of some bacteria in the blood. And here's a wild fact. This can be a totally normal, temporary, and harmless thing. You can actually get a little bit of bacteremia just from brushing your teeth or flossing. No big deal. But if those bacteria stick around and start to multiply in the blood, that's when things get serious. That's septicemia, a severe illness we also call sepsis. And in the worst-case scenario, you get pyemia, where you have septicemia plus abscesses, pockets of infection forming in organs far away from the original site.
And all of that, it really just boils down to one critical point. An infection that seems small, like an abscess in a single tooth, can absolutely spread beyond the mouth. If it's not dealt with, it can have genuinely life-threatening consequences for the whole body. That's why managing oral infections isn't just about saving a tooth, it's about protecting the patient's overall health.
Okay, so that brings us to our final section, our big takeaway. Let's tie all of this together and focus on why the mouth matters so much.
When you think about it, the mouth really is a perfect storm for these host microbe battles. First, you've got this incredible density of microbes, one of the highest in the entire body. Second, it's a major doorway to the rest of your system. And third, those hard, non-shedding surfaces of our teeth, they are the absolute perfect real estate for building those stubborn, fortified cities we call biofilms.
So I want to leave you with this final question to think about. Is the mouth really just a collection of teeth and gums? Or is it something more? Is it a critical gateway where our body is in a constant negotiation with this invisible microbial world? As a future dental professional, you're not just going to be fixing teeth. You're going to be a steward of that gateway, managing one of the most important interfaces between our bodies and the world around us. Thanks for joining us for this explainer.